Hello and welcome. I'm Steve Clemens, editor-at-large of The Hill. Thanks so much for joining us for our program today titled The Future of Medicare and Oral Health. Before we begin, I'd like to thank our sponsor, CareQuest Institute for Oral Health, for supporting today's conversations. Currently, Medicare does not cover oral health services as a standard benefit. If you've been keeping track of the Build Back Better legislation Democrats have been pushing in Washington, you'll know it includes an effort to expand Medicare by including dental, hearing, and vision coverage. Recent studies have found that nearly half of all older Americans and people with disabilities who receive Medicare benefits lack access to the care and resources they need to maintain good oral health. Poor oral health is often linked with other diseases, particularly affecting low-income seniors and those in rural and minority communities. Today, we're going to discuss potential challenges to Medicare and what that could mean for more integrated and equitable oral health care for beneficiaries. Before we begin, a few housekeeping notes. You can tweet us at @TheHillEvents using the hashtag #TheHillMedicare. We're broadcasting live, and we're going to take your questions throughout the program. As with any live stream, this funniest part for me, you could experience some occasional trouble. Refresh the page and it will all get better. Joining us to kick off the program is Congresswoman Nanette Barragán from California, a member of the Energy and Commerce Committee and a co-sponsor of the Medicare Dental Act of 2021. I spoke to her just a bit earlier.
Congresswoman Barragán, it's so great to see you, and thanks for joining us. This is not a topic I have dealt with before. It's something I didn't know very much about, but I just want to start out. Why isn't oral health covered under Medicare? Why isn't oral health, part of the health package?
Well, it should be, and that's a really good question, because we know that oral health and having access to a dentist for dental health is directly tied to our health, and it's directly tied to our heart. And so I think that, frankly, when they devised this coverage many, many years ago, I believe in 1965, they didn't have that. They didn't think about the tie and the connection. We clearly know about it now, and people point to cost, but we have to make sure that we are covering this because it's directly tied to healthcare and preventive care, which is so critically necessary.
So, I also noticed that in the Black community, the brown community, that there are a lot of folks that are avoiding dental care. Is it because of cost? Is it because there are other speed bumps out there in the way of that? And do you think by basically raising awareness about this broadly and dealing with the cost issue for a lot of folks so that it becomes more a natural part, we'll see more people building in, dental care into the way they approach their own personal health?
Well, people of color are disproportionately impacted by the current lack of dental coverage in Medicare. So adding dental coverage to Medicare is one step toward getting to racial health equity. Part of this is cost. Part of this is education on making sure people understand that seeing your dentist and making sure that you're flossing and you're brushing and all the things that go with dental care is directly tied to your health and is preventive care. And so I think there's a lot of those. Just in my own family, I can tell you my father never had teeth. My father was 59 when I was born. I never knew him to have any teeth. My mother, same deal. She had teeth, but she never wanted to go to the dentist. Part of that, no doubt, was cost, but the other part is education. But part of addressing equity is going to be access to dental care coverage, which is why this is so important. This is not a luxury. This is a necessity that we need.
Tell me about the bill that you are introducing to try to, this Medicare Dental Act of 2021. What would it actually do?
So my bill will allow there to be coverage for dental care for those who have Medicare. And we know that right now, there is a lot of conversation and a lot of talk about getting dental coverage and hearing and vision. So we know there's momentum behind this. One of the concerns that I have is that the current proposal under the current Build Back Better agenda is that the dental coverage doesn't kick in until several years. And really, people need that coverage now.
Right.
And so it's really important. If we take a look at like a 2019 CDC study on oral health, it found that 71% of Black Medicare recipient beneficiaries and 65% of Hispanic beneficiaries did not see a dentist in the last year, compared to only 43% of white beneficiaries. So there is a huge gap here, and there is a huge need here. And we need to start by making sure that those who have access to Medicare have access to dental coverage.
Now, when you talk to your colleagues, and I'm also aware that you have a lot of colleagues in the House, I think more than we've ever had before, who are actually medical doctors. I don't know how many are dentists, but the medical profession is pretty well represented amongst your colleagues in Congress. Are you finding a lot of support for what you're doing? Are you finding resistance?
No, there is a lot of support on providing dental coverage. Unfortunately, depending on who you talk to, it comes down to a conversation on cost. Can we afford it? And what I like to tell people is part of the problem in the United States is we focus too much on being reactionary instead of preventive care. That's going to save us money in the long run, which is why dental coverage is important. They'll recognize the importance of it, but it comes down to cost. So it just depends on who you talk to and on what side of the aisle you talk to folks. But I do know that there is a lot of momentum on this right now. And so I am hopeful that we can get this across the finish line.
But look, I find it a really interesting question. I mean, it's sort of a meta question, right? That this notion of cost, I understand there are cost issues, but it also perpetuates this notion that it's optional, right? That dental health and dental hygiene and dental care are optional. And I have to tell you, like you have family members, I have colleagues in where I work with, who have just suffered a major, health challenge because of, dental issues. And so I think one of the things that's perpetuating others, you're going to change the frame. Part of it is to look at a person's whole health, which is what I thought the Affordable Care Act was trying to do in a wellness perspective. So, if you get back to wellness, wouldn't dental health automatically be part of that package?
Absolutely. And you have to remember our bill is just a step in that direction because it's only for Medicare recipients. It's not universal, which we need to eventually get to. And frankly, important that kids have access to dental care because it starts very young. But you're absolutely right. There is a very clear connection, which is why I think it's important that we continue to push this notion of providing that coverage to everybody. We're hoping that Medicare recipients can be the start of that because it's, as you've mentioned, dental care is crucial part of healthcare, and it's really not a luxury. And, there's also this fear. Sometimes we talk to folks about going to see a dentist. And part of that, I think, has to do with the fact that if you didn't see a dentist when you were younger and you're not used to it, there could be that added fear to it.
One of the other steps that I know that you have been part of and supported is you recently voted, as I've been told, for the dental insurance program for veterans in the Veterans Administration. And so is that, I think the logic of that makes a lot of sense given what you're trying to do. I don't know what the vote count was. Was there much opposition? Was there a party line vote when it came to providing dental insurance for veterans?
Well, let me tell you, the number one group that we should be taking care of are our veterans who are coming home and making sure they have access to all the care. So I'm glad to see that the dental benefit for veterans is now happening. And we often hear on a bipartisan basis that we're going to take care of our veterans, and it doesn't happen often enough. I'd have to go back and kind of check to see what the final numbers were. But I'm glad that we got it through and that, our veterans are getting this benefit that's so critical.
As we're thinking about this, while we have just a minute or two left, I'm interested in the debate that's been happening in Congress over the reconciliation bill. There are just lots of different frames. It's so big, I'm not even sure what's in it or not. I'd like to know whether your efforts on dental coverage are covered in the reconciliation bill. But I'd also like to kind of ask you the question when it comes to your district, your district and your constituents in California. How do you feel the reconciliation bill as it's shaping up is going to affect their lives? Is there the connectivity between that bill and what's being discussed and what you're trying to deliver for your constituents?
Well, first of all, my bill, the Medicare Dental Benefit Act, just had a hearing in Energy and Commerce last week, and it got a markup, and it is included in part of the $3.5 trillion reconciliation package, which we're calling the Build Back Better agenda. So it is in there, and that's the good news. When it comes to my constituents, we're talking about a district that's the fourth poorest in the state of California. Across the country, it's on a list of about 358 out of 435. So we're talking about the folks that really cannot afford a $400 bill, which is very easy to get if you see a dentist. So this bill will be critically important for them to get access to dental coverage. But the reconciliation bill overall has many things in there that families need, that working people need, that we hear day in and day out. Make sure you're there fighting for these things, whether it's in-home care and expanding access to that, whether it's childcare. There are so many things, paid family medical leave. I mean, the thought that you get sick and you cannot take time off and have that paid family medical leave to recover and take care of yourself or a sick one, it's nuts. So people are counting on us to get the Build Back Better agenda done. And I have to remain optimistic about that ability, including this portion of reconciliation of the dental coverage for those with Medicare to get across the finish line. People are counting on us.
Well, listen, I just want to say thank you. This is a topic I haven't discussed before. I sort of thought it was part of the package of health and Medicare out there. I'm very glad to hear about your work. So Congresswoman Nanette Diaz-Barragan from the 44th District in California, thank you so much for your time today.
Thank you, Steve.
And now we've got a message from our sponsor, the CareQuest Institute for Oral Health. Please welcome Dr. Maisha Minter-Jordan, President and CEO of the CareQuest Institute for Oral Health, in conversation with Dr. Eleanor Fleming, Associate Professor at Meharry Medical College. Maisha, over to you.
Good afternoon. My name is Dr. Maisha Minter-Jordan, and I am the proud President and CEO of the CareQuest Institute for Oral Health. I'm excited to be with you this afternoon to discuss an important topic that matters to us all. The CareQuest Institute is focused on ensuring equitable access to integrated healthcare for underserved population. One of the things that we are clear on is that oral health is healthcare. And we are so excited to have so many leaders amongst us today who believe the same. I am thrilled to be joined today by Dr. Eleanor Fleming, a diplomat of the American Board of Dental Public Health. Dr. Fleming is a veteran of the Public Health Service and has served as a dental officer epidemiologist with the Centers for Disease Control and Prevention. We're going to spend the next few minutes talking about the inequities that exist in oral health care, the opportunity that we have in front of us, and how we can finally solve these long-standing challenges. Welcome, Dr. Fleming.
Thank you.
So, Dr. Fleming, your path to dentistry is a unique one. Can you tell us about it, please?
Absolutely. You know, I found my way to dentistry through Dr. David Satcher and the first Surgeon General's report on oral health. At the time, I was in graduate school, and when I heard him speak about oral health disparities, that information left me dumbfounded. I did not understand then and don't understand now how it is possible that people do not have access to dental care. I grew up going to the dentist and the orthodontist, saw dental offices everywhere in my hometown. So the idea that people do not have access to care makes no sense to me.
I think you and I share that same sentiment. As a practicing physician and in my former role at a community health center, one of the things that I was struck by was the children in our Head Start and Early Head Start program, in the amount of oral health disease that they had. And I learned that in order to correct that oral health disease, we were putting little children under anesthesia. And the thought that that was preventable was dumbfounding to me. And it made me really look towards how we could have a more integrated system within our community health center. And that thought has carried me through to the work that we do today at the CareQuest Institute for Oral Health.
You know, that is a great point, and I think that we have that shared experience. I mean, at my local Boys and Girls Club when I was in high school, I didn't understand why these children had so many silver teeth. And I didn't understand, like, why do these kids have this? And, you know, come to find out, you know, the children had decay, and to save their primary teeth so that their permanent teeth could erupt, you know, their pediatric dentist had to save those teeth and protect them with stainless steel crowns. And so here we are with little ones with shiny teeth, and, you know, one wants to be excited and not make the child feel, you know, different. But one must wonder, why is it that, at least for me as a Black woman, why is it that Black children have that disparity in care and have that experience with disease when we know what works to prevent dental decay?
You are so right in that. So at CareQuest Institute, one of our greatest missions is ending the deep disparities and inequities that exist in oral health care for our most marginalized populations. The first report that you referenced was published in 2000. Can you tell us about some of the inequities that exist today?
As a dental epidemiologist, I approach problems of inequity from a systems level. Our systems are failing millions of people, and Medicare is a great example. Medicare's lack of an oral health benefit means that nearly half of all enrollees, more than 24 million Americans, do not have dental coverage. These are disproportionately Black, American Indian, and Hispanic people, those with disabilities, and those living in rural communities who are left without a way to afford the care that they need to maintain not only their health, but also their well-being. The statistics are astounding. And the last year, 7 out of 10 Black Medicare enrollees and 6 out of 10 Hispanic enrollees did not see a dentist. And 20% of rural seniors have not seen a dentist in more than 5 years. And we know as clinicians that, we encourage our patients to visit a dentist at least twice a year.
So I think for many of us, those statistics are not really surprising. I think we know that they've long existed in particularly marginalized and underserved populations. Understanding the data is critically important, but let's talk a little bit about what those statistics actually mean. What is the result of someone not being able to access integrated and comprehensive oral health care?
This is a critical problem because research shows that oral health is inextricably linked to overall health. Poor oral health can lead directly to a higher risk of chronic diseases like diabetes and heart disease. It can also contribute to depression, poor maternal health outcomes, and sometimes death. Research from CareQuest Institute and others have shown that poor oral health increases risk associated with COVID-19. Despite this, many state Medicaid plans, do not cover basic dental care for adults. It makes absolutely no sense from a medical or policy perspective.
I think you are exactly right in the sense that failing to cover dental benefits under Medicare makes no sense from a medical policy or ethical perspective. If the pandemic has shown us anything, we know how inequitable our healthcare system is and how vulnerable our seniors are. Including dental coverage under Medicare will help address both of those challenges. Can you talk through some of the reasons why covering dental care under Medicare makes sense from your perspective?
You just laid out a number of important reasons, and personally, I find this to be an equity and social justice issue first and foremost. But let me also add, it makes financial sense. Studies have shown that adding the dental benefit would result in a reduction in long-term healthcare costs. Providing benefits to people with chronic diseases has been shown to result in reduced healthcare spending. Additionally, people without dental benefits also find themselves seeking care at emergency departments, which are not equipped to provide the type of care and also add significant cost to our healthcare system. One estimate of the cost of avoidable emergency room visits nationwide for dental reasons is $1.7 billion annually.
So we've laid out an incredible case for the inclusion of an oral health benefit in Medicare. We've talked about the data, we've talked about the moral case, we've talked about the inequities that could potentially be solved by this inclusion of a benefit under the Medicare policy. As you think about what happens with Congress, and if this is truly passed, what do you see as next steps?
Well, strengthening Medicare would be a great start, but there is a lot more that we need to do to create a healthcare system that works for everyone. It's important to note that a dozen state Medicaid programs, including my own state, do not cover routine dental care, which again has a disproportionate impact on low-income people and people of color, and that needs to change. As you mentioned, we also need to take a look at how we deliver and pay for care. We should move from a system that compensates providers not based on the number of procedures they complete, but on the quality of care that they deliver. Transitioning to value-based care is a way to do that. Now, the advantages of value-based care are clear: greater innovation, lower costs, and more importantly, better health outcomes for patients and populations. Getting to that reality, however, will take innovation, persistence, and a redesigned oral health care system. You know, I realize that this is a lot that needs to be done, but I know that we can get there. And the step that Congress is considering now, with the dental benefits added to Medicare, is a critical step in that direction.
Dr. Fleming, thank you so much for an engaging and informative conversation. Your perspective and your expertise has been enlightening for so many of us here today. We are on the brink of an important moment in our nation's health history. This is the time for us to stand up as leaders, to become engaged in this fight, and to ensure that Medicare finally addresses the oral health of seniors, millions of seniors across our country. I am emboldened, engaged, excited, and committed to ensuring that this happens for seniors. Because we know that if this happens, the inclusion of oral health in Medicare will finally begin to address some of the systemic inequities that have plagued our country since its inception. We'll finally begin to address some of the disparities that our seniors face and the inequities, particularly that people of color face as it pertains to accessing oral health. This will set a moment in time for us to learn from, to us to move with, and I'm excited to be able to do so. Thank you so much for joining us, and thank you so much for being committed to ensuring that oral health access is equitable for all. Thank you.
Maisha and Eleanor, thank you very much for that discussion. I learned a lot. Appreciate it. We now have another perspective we're going to bring in. My next guest, Congressman Drew Ferguson from Georgia, was a rural dentist for 25 years. He's currently the Republican Chief Deputy Whip in the House. Let's find out what he has to say about oral health and Medicare. Congressman, it's great to see you. I have to say something. My dentist is a guy in D.C. named Cy Khan. And it has taken decades for me to develop a good relationship with a dentist. And I finally have it. Finally have a relationship. So, so I don't need you for services on that, but I do want to kind of get smarter, on dental care. And as we think, and we just heard Maisha Minter-Jordan, the president of CareQuest Institute, she made a comment that said oral health is health care. And I'd love to get your thoughts on that before we get to the question of who pays for it and how we broaden it, how we get access. But are you on board? Because I'm just interested that we seem to have segmented healthcare into different competitive slots. Where are you on that?
So, well, thanks for having me, and I'm going to make some very brief comments, and then they've called votes, and I've got to get over to the Hill. But let me make a couple of very quick comments here. First of all, dentistry in the past has been something that is healthcare that works because there's a doctor-patient relationship that exists, and we're able to have really good conversations with our patients to provide the care. Here's the challenge that we see with the current Medicare legislation. We see it as an empty promise to seniors. While we recognize that providing care to seniors is important, what we're seeing in this bill is a bill that actually doesn't fund this fully until 8 years down the road. It puts immense pressure on the current Medicare system, and there are no additional revenues coming in to help support this in the short term. So we see this as a majorly flawed product. The other thing that I will say is that when the policy writers were writing this policy, they did not speak to a single member of Congress who is a dentist regarding these policies. We've got something to say about how this should be done, how it can be done. And look, I practiced dentistry in a rural community for more than 2 decades, in a community that was about 62% African American in a economically depressed area. I've got ideas about how to do this, and they simply were not included. And my biggest fear is that this is going to be a promise to our seniors that can't be fulfilled because the entire provider network is going to back away from the program because it looks like it's not going to be able to be sustained. And dentists can't stay in business losing money under current Medicare, under what we anticipate CMS will do with this. So with that, you have my pledge to continue to work on this area to help our seniors. But in the end, what's being proposed right now is an empty promise.
Do you have a strategy or suggestion or an alternative plan? I mean, one of our focuses is how do you reach underserved communities? How do you reach elders? I mean, is the answer to go ahead and upload the payments on the front end of that? Or do you have other things that we ought to be doing when it comes to making health care more holistic and understanding that oral care, dental care is part of a package that, should be part of the American social contract somehow?
Well, first of all, again, I'd love to have this discussion, and I'd love to have it with our committee. But right now, as I said before, I apologize, but I've got to head over to votes. But I look forward to future engagement, and thank you for having me on this very important program.
Really appreciate it, Congressman Drew Ferguson, Chief Deputy Whip. Thanks for joining us. Well, that was fast. And now it's time to hear from our panel. I'm delighted to be joined by Charlie Birch, President of the American Dental Hygienists Association, Nancy Lamont, Executive Vice President and Chief Advocacy and Engagement Officer at AARP, and Paul Gibbs from West Valley City, Utah. He's a real person. He's an independent filmmaker. He's a kidney transplant recipient, a Medicare beneficiary. I think everybody's a real person, but Paul's a little bit more real for me today. So listen, we just have had some different perspectives this morning. Two members of Congress, one had to run rather quickly, but said that this notion of advancing dental care into Medicare is something that he finds flawed at this moment. We heard another strong, vociferous support of that. And let me just start with you, Nancy. You have a lot of members that this would impact. How do they see this? Where are they? What are the strengths of the proposal that's on the table? What are the weaknesses?
Well, overwhelmingly, our members are supportive of dental coverage in Medicare. I don't think that would surprise anyone. And we're so grateful to you, Steve the Hill, and CareQuest for sponsoring this program. I've been around a lot of years and done a lot of programs. And frankly, this is the first time we've had a serious discussion of dental benefits in the Medicare program. And we're just delighted that we are at this point. It is so important for reasons that you covered in your opening and the Congresswoman mentioned in her remarks. When Medicare was created in 1965, it was a medical services program, and dentistry wasn't seen as part of that. Over the years, we've taken a broader view of healthcare and wellness, and this is a critical part of it. Think about it. In 1965, when Medicare was created, 40% of adults still smoked. Jogging hadn't been invented as a way to get us off our couches, and cars didn't have seatbelts. And we've come to understand that healthcare relates to behavior, it relates to prevention, and we think this discussion of the absolute importance of including dental benefits is critical. Again, as other people have mentioned, our members talk to us all the time about how they need dental services. They need to be able to get this kind of care to help them with their nutrition. We know that not having proper kind of management of your teeth can lead to social isolation and mental health issues. So to go back to your first point, this is so important to our constituency. They want to see Medicare coverage above the shoulders, and talking about dental care and eye care and vision and hearing has been so important.
Thank you for that. Charlie, let me ask you a question. I'm going to try to build off of what the congressman just shared with us. He's making the point, and honestly, I don't have the time right now to kick the tires on whether he's right, but basically arguing that this expansion of Medicare to cover oral health and dental health backloads the cost back, and that you would end up with a disproportionate burden on the near term on the dentist profession. So part of his complaint is on the ecosystem of money and benefit in that level. And you folks at the American Dental Hygienists Association support this. So what would be your response to the congressman? Do you see it the same way?
We don't see it the same way. We have a bit of a different perspective. As dental hygienists, our focus is on prevention and therapeutic oral health care services. And we know as a backbone of public health dentistry that prevention is the primary way that we can actually cut costs in the system, and we can actually improve outcomes for all patients. The status quo and how we're delivering dental care and oral health care to seniors specifically is not working. We know that many of our seniors are suffering and don't have access to treatment. And when they do end up being able to pay for treatment themselves, their average out-of-cost pocket is just immense. It's enormous. And so it's an economic burden on them. As for dentists, I can't speak for them. I know that the American Dental Association's advocacy campaign has focused on the reimbursement concerns. But we at the American Dental Hygienists Association we're really focused on our patients' outcomes, and not just for oral health, but their overall health. It is absolutely essential to well-being to have a good, healthy mouth.
Well, thank you. Paul, let me jump to you for a minute. And you've had such a powerful and interesting story. And I guess the way I want to frame this is when I spoke to Congresswoman Barragan earlier, and also I spoke to another member of Congress recently for another show we're doing on cancer. Both of them make the point that the routineness of contact with health practitioners is really important in cancer, in dental care, and others. And I guess your story is one, as I understand it, where that routine contact was impossible. Am I right?
Yes. I became a Medicare patient because I was in end-stage kidney failure. I was born with kidney issues that caused me to have several surgeries when I was a child. And then back in 2009, I was told that I needed a kidney transplant right away. And as part of that, I had to have a complete workup of pretty much every system in my body. And that included a dental examination, a thorough dental examination, because the poor dental health could be a danger to the kidney. They very much saw all of this as related, as part of an overall whole. But while my Medicare that I qualified for covered everything else, it didn't cover the dental exam. I was able to scrape up enough money to get the dental exam, and the dentist cleared me for the transplant, but she told me that I had other issues, some cavities and other things that could be a danger if they weren't taken care of. But I had no way of affording that work right then because, again, Medicare wasn't covering it. So it wasn't for another 5 years that I finally got dental coverage through my wife's employment. I was working part-time and freelance and things like that. I'm a filmmaker, and that leads to a lot of freelance work that doesn't necessarily give you that kind of coverage. But with my wife's employment, I did have finally that steady dental coverage. And, that came just right at the same time that I started having serious problems with my teeth from those things I hadn't been able to get coverage for in the time between that. I hadn't been able to see a dentist since my transplant. And suddenly I was having teeth hurting very badly. I was having teeth breaking apart. And because of that, I've been through a lot of dental issues. I've lost 4 teeth. I had one tooth that had gotten bad enough that it led to an extremely painful extraction that took part of the bone with it. Just last month, I had to pay $1,400 out of pocket for 2 root canals. And that's because all of these things that should have been taken care of years ago were not able to be taken care of because they were not covered by the Medicare. If Medicare had covered my dental care back in 2009, then my experience would not have to have been so invasive, expensive, and complicated.
Wow. I mean, that's such a powerful story, Paul. I appreciate your candor about your personal story. Nancy, let me ask you, just listening to this, and again, I try to maintain good, objective, dispassionate distance on these issues. But objectively, it sort of sounds like we've created a system of a la carte health that has some zero-sum tensions, that with what Paul was dealing with as a Medicare patient and the parts of his health that were covered, was having to do battle with other parts of his health that were connected, but yet he couldn't get it. And it just doesn't make sense to me. Can you make sense of it?
I can't make sense of it, and that's why we're so pleased with the discussions that are underway now as part of the reconciliation bill. And as both other panelists mentioned, we think this is going to be a huge step forward in providing more complete health care to people. And over the longer run, it will reduce some costs. Right now, we know roughly half of all Medicare beneficiaries did not go to the dentist last year. And the half who did, about a third of them had costs over $1,000. So we know this is a cost issue. We know this is an issue where people aren't getting some care, which is leading them to get sicker and requiring other care. And we hope that by offering dental services, we'll see some reductions in hospitalizations and other treatments, especially for people with diabetes and heart disease. And so this is a huge step in covering the full person's health needs. And we support it being a critical part of Medicare Part B. It's the only fair and equitable way to ensure that Americans have access to the care they need.
Well, thank you for that. And Charlie, in your world, as you kind of look at this element, of dental care hygienists, we actually have a question coming up in a moment from a dental care hygienist that I would love to pose to all of you. But I'm wondering, when you kind of look at this question as well on benefits and coming back to who pays, how do we have the cost, how do we look at health? My understanding during the debate over the Affordable Care Act, or the intention of the Affordable Care Act, and we can debate whether it's achieving its goals or not. I know it's a separate question than Medicare, but it was the notion of embedding wellness. And that covered mental health, that covered other dimensions of health, a kind of holistic vision of health. And I know you cover a corner among the folks that you deal with within your profession, but are we tilting now towards an inclusive version of holistic health, or do we have a long way to go before we have that whole picture?
Well, we have a ways to go. I would say, as a dental hygiene practitioner here in Kentucky, I have seen my home state. I've seen this real. We have a very high prevalence of edentalism, and our policies at ADHA are focused on optimal oral health for all people. And we really believe that access is incredibly important, and comprehensive integrated care for dental benefits in Medicare Part B will be able to deliver to millions of seniors care that they desperately need for their wellness. Oral health is not a standalone optional piece of health for a person. It is absolutely integral to overall health. As Paul was saying, his story is one that is not one I have not heard of before, and we hear over and over again. It's very common. When oral diseases go untreated, we know that individuals are at higher risk for diabetes and heart disease and stroke. I myself have worked with individuals who were pregnant and trying to make sure they didn't have preterm low birth weight babies due to their oral conditions. And so we know that these health conditions are really impacted and can get worse. And that is going to cost us more overall in our healthcare system if we don't address it. So it's very, very important that we cover oral health coverage for seniors, that we cover them for our special populations in Medicare. And the place to do that is in Medicare Part B in a comprehensive way, so that we can really, truly address the cost in our entire delivery system.
Just before I jump to our questioner, we have a questioner who is a dental hygienist. I want to ask Paul, a technical question. So you're married and your wife has some insurance. I'm just interested in the way different patchworks lay over each other, the way we all try to achieve health care, right? So you have a spouse and she has certain health care provisions. You're also a Medicare recipient. How do they lay over? And did that layover solve your problem of dental? Is that how you got there? Do you see other paths that we may not have discussed on the show today, that we may not be aware of other paths to it? Or does that really raise the stake of why including dental coverage in Medicare is so important?
I think it really demonstrates why it's so important. For me, they did lay over. I have the dental coverage through my wife's coverage, and that has been incredibly fortunate for me. But, that came along because of the circumstance that within a year of my kidney transplants, I fell in love and within a few years was married. That, I don't think we can consider that an alternative plan to getting dental care. I don't think that's something that's just going to come along for everyone. I mean, I hope it does at some point in their life, but we can't rely on it being within a few years like that. So my circumstances for how I got the dental coverage were, I think, pretty atypical. That was just kind of a lucky break that I got, that I met a wonderful woman and married her, and she ended up working in the dental manufacturing field, and that was actually why she had access to such good healthcare coverage, dental coverage. So it was really a combination of special factors that we just can't count on for other people. And until then, again, until she had that coverage that was extended to me as her husband, I had no dental coverage, and I was seeing a variety of specialists that were being paid for under Medicare because the systems are so complex and all work together. I was seeing a nephrologist, a urologist, a neurologist, gastroenterologist, all these things that could take care of my other problems. But these dental issues that, again, we knew before the transplant were a potential danger to the kidney, I couldn't do anything about them because they were not included by Medicare in that overall whole of my health. And again, the doctors knew that they were part of that overall whole. They insisted on that dental workup right along with the cardio workup, everything that I needed. So the doctors knew it was a vital part of it. But the Medicare didn't cover it.
No, well, thank you for that story and helping us to understand how complex the pathways are. And I take you at your point. I mean, it's just fascinating. I was talking to somebody the other day that some people get, opioid treatment and find the only place they can get is by going to jail. You made the comment that it's not a good thing, that if you need dental care and you have other issues, that you don't need to just go get married to get somebody's health insurance. I mean, it's a very interesting point you made. So I want to be too blunt, but I was very impressed with that. Look, I'm going to tell my team, we have two questions for you, and I want to make sure that they know where we're going first. We're going to go to Ms. Tomika Flowers, who is a dental hygienist. We have a question for you from Tomika, so hopefully we get this stacked right. Tomika?
Good afternoon. My name is Tamika Flowers. I'm a registered dental hygienist working at a federally qualified health center located on the south side of Chicago. My question for you today is, since Medicare benefits lack access to care and resources they need to maintain good oral health, are you willing to support public health dental hygienists or dental hygienists as mid-level providers with the ability to provide care, preventive care, to older Americans and people with disabilities outside of the dental office setting?
So I was going to have Tomika's question addressed to our congressman, but he had to run off on short notice. So I'm going to address it to Nancy Lamont of AARP and say, it's a very interesting question, which I hadn't thought about out-of-office settings and reaching people where they're at. Where are you on that front?
Well, of course, one thing we've learned in the course of COVID is that healthcare and health services have to be delivered in a variety of settings. And I think as we evolve in our work and expansion of Medicare, particularly in terms of oral health, we should absolutely look at that. Right now, we're very focused about getting coverage in Medicare. As part of this reconciliation bill. We're very pleased that there's leadership in both the House and the Senate to do this, to put it in Part B and to move forward with a comprehensive benefit as soon as possible. And we will work, as we have on telehealth issues and other service delivery issues, to ensure that people can get care where they are. And I have to say, I really appreciate hearing this recommendation, and we will look at it as we hope to get to a point of implementing a very serious and comprehensive dental benefit.
And I'd love to jump to you, Charlie, real quickly on this. We're going to take another question, but as you do it, I was very taken, in our sponsor segment, which it's very different. I'm usually not that interested, but you kind of hear Professor Eleanor Fleming of Meharry Medical College say that she read this Surgeon General report from Quinlan. I think it was Dr. Satra, if I have that correct, and she was dumbfounded about the explicit connection. Now, I interviewed Dr. Satra on mental health issues a long time ago. He was a ways back. So this has been percolating out there for a very long period of time. So I'd love to just ask, dovetail on top of Tomika's question and say, hey, might we adjust this with hygienists and out of care? But then also look at this like, I don't know, the foil that our Surgeon General and a special report laid this out long ago. And what's the shame on us for not, maybe Medicare is the wrong answer, I don't know, but for not fixing that? It's been out there a long time.
It has. I was a dental hygiene public health practitioner when that was released in the year 2000. And it was instrumental in refocusing our entire profession, the conversation around oral health and the understanding that oral health is absolutely integral to general health, and that you're not healthy if you don't have good oral health. It was one of the things that we've used, as you said, for a number of years for us in the dental hygiene profession, and specifically the American Dental Hygienists Association, our organization, in saying, hey, we are educated, licensed professionals. Our job is prevention and therapy, and to actually intervene in disease. And we are ready and able and willing to do the work. Put us in places where we can do the work. And so we have spent many years advocating for dental hygiene professionals being able to do the work that they're fully qualified to do in the spaces where people need the help.
Well, great. Well, let me get another question in here. We'll get Paul in on the next question from Thomas Levenger. Tom?
Many individuals on Medicare have difficulty getting out of their residence for a dental appointment due to factors like lack of mobility and/or transportation. They often end up putting it off until it results in a painful emergency or even hospitalization. Mobile dentistry has proven to be a saving grace for this population to help them keep up on their dental needs. Unfortunately, due to the extra time and cost for the provider, it ends up being too expensive for most Americans. Has mobile dental care been considered in this policy change? And if so, would there be any additional reimbursement to cover the provider cost for providing the service when needed?
Again, I have no idea whether our panel can answer this, but we're back to mobile, mobile and local. Paul, just before we jump to our other two colleagues here, where you're sitting, and as I understand, you're in West Valley City, Utah, right?
Yes.
Which part of the state is that in?
It's just west of Salt Lake City.
So just west. So I'd be interested, again, not only in your story, but in your observations, because Utah is innovative out there in healthcare. They have, a population. They also have a big care culture. I'm just interested whether the mobile dimensions of health, whether they're in dental or others, have taken hold in your area.
I have not seen much of that personally. Where I've seen some innovation, particularly during the pandemic, is in telehealth. But I personally haven't seen as much of the mobile side of things. I know there has been some effort towards some mobile healthcare. That's not something I've personally experienced.
Right. Thank you. Well, let me go to Nancy and to Charlie for some final thoughts on this. Nancy, Charlie, again, back to the mobile dimensions. But let me just give you an opportunity as we close out. What do we have to most get right? Nancy?
Well, let me start with mobile. We are nowhere near we need to be to care for people who are in their homes and have trouble getting to offices. We have a lot to do. We've learned a little bit during the time of COVID about the importance of this, but we need to be much more aggressive, and we will be at AARP. Over the years, we no longer think about just going to a doctor's office for basic care. We go to urgent care centers, we go to health fairs with our employers, we go to drugstores. And yet the ability to get a doctor to come to your home for basic services is very difficult and an area we have to focus on. You know what we have to do right? We have to get the dental benefit in Medicare as part of the reconciliation bill. We need to move forward once we have it in Part B to ensure that it's comprehensive, can be implemented as soon as possible, and that we take into consideration so many of the issues everyone has raised today. How do you actually deliver these services? How can we ensure that that dentists and dental hygienists and assistants are able to provide the care they're trained to provide? And how do we move forward from there? It's a really wonderful opportunity, and I hope we can all take full advantage of it at the end of this this difficult legislative process.
Thank you. I'm so happy to have your insights, Nancy. Charlie, I'm going to give you the last word on this. What mobile plus what do we most have to do to get this right?
Well, I absolutely agree with her that we are terribly behind in teledentistry. The conversation is decades old for us, and that work and that effort needs to continue. I think what we've got to get right is we have to remember we're not alone, that we have many, many constituents, both Democrat and Republican, who are very much in favor of this benefit. We have fellow oral health professionals, many other oral health professional organizations. Just the past couple days, we signed a statement going to Congress in support with the American Public Health Dentistry, National Dental Association, the American Institute for Dental Public Health. We have many partners in this, and to get it right, we collaborate, we communicate, and we continue to advocate for our patients and the communities that we serve.
Well, thanks to our two members of Congress and to all of you and to our great last panel here, Charlie Birch, President of the American Dental Hygienists Association, Nancy Lamond, Executive Vice President and Chief Advocacy and Engagement Officer at AARP, and Paul Gibbs. I want to say, you know, at one time a victim and now a hero and champion of healthcare and, you know, a Medicare beneficiary. We really appreciate your candor, Paul, and for you sharing your story. I always love to have real stories. Helps bring this stuff to life. So thank you all for joining us.
Thank you.
Thank you.
Thank you.
Well, that brings us to the end of our program. A very big thank you to CareQuest Institute for Oral Health for its support and to all of you attendees for joining this discussion. I want to give CareQuest a special shout out because I thought that was a great discussion they had today. For those of you who missed these conversations, we'll have the video up from the event up on our website shortly. I'm Steve Clemens. Be well.